I had a stroke on my 18th birthday. I had to go to a whole bunch of different doctors. Then they did an echocardiogram and ended up my heart was failing. So they decided I had to have a new heart. I was in Duke University of Hospital for 3 months, and then I had to wait for my heart, and finally got the heart August 31st, 2018. Then I got pregnant with Landon in December of 2021.
Brianna was referred to our center because people identified early in her pregnancy that she had had a significant history of heart conditions in her prior pregnancy. So when she came to us with another pregnancy, things we wanted to talk about first was just, what is it like to be pregnant when you've had a stroke before, when you've had heart failure and a heart transplant before?
He told me from the beginning that whether I decide to terminate it or I decide to go through with it all, he was going to be beside my side the whole way. He told me that he's seen people with transplant have babies, and he thought I would potentially do that. He made me feel really safe when I was scared the most in my life.
The goal of the Pregnancy Heart Team is really to work as a team of experts with a background in high-risk obstetrics or maternal-fetal medicine, my specialty. Cardiology, work really closely with Dr. Carrie Ward, who has a tremendous expertise in the cardiac care of pregnant people, and special expertise in the care of pregnant people with congenital cardiac disease.
Women are often told they cannot have babies by physicians. And a lot of that is based on just not really having experience or knowing the answer or data to support pregnancy. There aren't many places in the Southeast that have a pregnancy heart center. Right, so we really have a catchment area that is quite broad. The reason we stand out, I think, is partly related to the people we have, and also, Duke as an institution has just always been a place where it was okay to do new things. We at the Pregnancy Heart Center work very hard to make sure that we support and listen attentively to all of our patients.
When we take care of patients who have complex medical conditions, it's important that we remember that not only are we taking care of a pregnant person who has medical needs, we're taking care of a person who has a life as well, who has a family, who may have job needs, who may have transportation challenges. Our care navigator provides an essential service in helping us respect the need to make pregnancy care as convenient as we possibly can to accommodate all the other things about a person's busy life. That person is just a phone call away and able to really be a first point of contact. And if there is a question that requires your referral to one of our physicians, able to reach out to that person directly and get an answer quickly. So I think it's a really important role, and I think a signature part of the care we provide here at Duke, making sure that patients have the best coordinated, most convenient care possible.
What I would say to another woman that was ever experiencing something I went through was not to give up and to trust Duke, because Duke was really there for me.
We know that maternal mortality in this country is far higher than it ought to be. And we know that heart disease is the #1 medical reason why people suffer morbidity and mortality related to childbirth. I think we've learned over the years that while all of us in medical care have very big expertise, we're better together. Knowing that the work we're doing is helping ensure that pregnant people have safe, happy, healthy births is such a gift.